One of the biggest, and I mean the absolute biggest failures of the response to COVID 19 has been the lack of adequate and accurate information. The Epidemic Intelligence Service is considered America's shock troopers in combating disease outbreaks. Come on. You didn't think I was going to spend the entire episode talking about a virus and not drop outbreak. Anyway, the EIS has more than 3,000 graduates. The group acts like a secret society, but for saving people. If you have a question or need to understand the local politics somewhere, or you need a hand during an outbreak, you reach out to the EIS network. They'll drop everything to help. The medical director for infectious disease at Evergreen Health, a hospital in Kirkland, just east of Seattle, highlights the importance of information during a pandemic. Upon learning of the first domestic diagnosis, the director told his staff, from emergency room nurses to receptionists, that from then on, everything they said was just as important as what they did. One of the EIS's core principles is that a pandemic is a communications emergency as much as a medical crisis. Members of the public entering the hospital, Rito told his staff, must be asked if they have traveled out of the country. If someone had respiratory trouble, staff needed to collect as much information as possible about the patient's recent interactions with other people, including where they had taken place. You never know, Rito explained, which chance encounter will help shape a catastrophe. There are so many terrifying possibilities in a pandemic. Information brings relief. Let's take a look at one of the president's COVID-19 briefings to see what life-saving information that he shared with the people. Surely his staff has told him the same thing that Rito told his staff, which is that good, strong, accurate, scientific-based information will help calm, educate the people, and allow us to make better decisions. Let's go ahead and cut to one of the president's briefings and see what guidance he had for the American people.
Whether it's ultraviolet or just very powerful light. And I think you said that hasn't been checked, but you're going to test it. And then I said, supposing you brought the light inside the body, which you can do either through the skin or in some other way. And I think you said you're going to test that too. Sounds interesting. Right, and then I see the disinfectant, where it knocks it out in a minute, 1 minute. And is there a way we can do something like that by injection inside or almost a cleaning? Because you see it gets on the lungs and it does a tremendous number of the lungs. So it'd be interesting to check that. So that you're going to have to use medical doctors with. But it sounds interesting to me. The new headline is Trump asks people to go outside. That's dangerous. Here we go. Same old group. You ready? I hope people enjoy the sun. And if it has an impact, that's great. I'm just hearing this, not really for the first time. I mean, there's been a rumor that, a very nice rumor that you go outside in the sun or you have heat and it does have an effect on other viruses. But now we get it from one of the great laboratories of the world, I have to say. It covers a lot more territory than just this. This is probably an easy thing, relatively speaking, for you. I would like you to speak to the medical doctors to see if there's any way that you can apply light and heat to cure. If you could. And maybe you can, maybe you can't. Again, I say maybe you can, maybe you can't. I'm not a doctor. But I'm like a person that has a good you-know-what.
Wow, we are so So this administration didn't do a good job with the communication, but that doesn't mean the government always has done a bad job. The information should have been taken seriously way back in 2005 with the Bush administration's plea to Congress to fund a pandemic preparedness plan. Bush's strategy was created to meet three critical goals: to detect outbreaks that occur anywhere in the world, to protect the American people by stockpiling vaccines and antiviral drugs, and improve the ability to rapidly produce new vaccines against a pandemic strain, and to be ready to respond at the federal, state, and local levels in the event that a pandemic occurs. If properly funded, this would have been a good start. But the information fell upon deaf ears that did not want to believe that a pandemic was coming, despite loads and loads and loads of research demonstrating otherwise. The Bush administration wasn't the only administration with a little foresight. The Obama administration also created a vital plan that has not been employed, despite the fact that it was written in response to the somewhat shaky handling of a previous experience the country had with similar outbreaks of influenza, such as the H1N1. In January, the National Security Council chucked that thing straight out the window and instead decided to go for an ad hoc process that left them consistently running days or weeks behind on its response. They straight up threw out what is essentially pandemics for dummies. Pandemics for dummies. The goal of the playbook for high consequence emerging infectious disease threats and biological incidents was to assist the U.S. government experts and leaders in coordinating a complex U.S. government response to a high consequence emerging disease threat anywhere in the world with the potential to cause an epidemic, pandemic, or other significant public health event, by providing a decision-making tool that 1. Identifies questions to ask, 2. Agency counterparts to consult for answers to each question that could come up, 3. Key decisions which may require deliberation through the Presidential Policy Directive process or its successor, the National Security Council process. The playbook also includes sample documents that can be used for interagency meetings that need to be called at each stage of the process. While each emerging infectious disease threat will present itself in a unique way, a consistent, capabilities-based approach to address these threats will allow for faster decisions with more targeted expert subject input from federal departments and agencies. You know, like having a plan, other than, just saying it'll go away. The playbook represents a collaborative effort to respond to crises. The fact that the Trump administration refused to use the guide proves that the United States is not ready to respond to biological warfare, or any kind of warfare for that matter. Unfortunately, the research just shows that the United States is not prepared for biological or chemical attack. However, the problem is not the country's ability to physically prepare for biological or chemical warfare. It's that the government is too divided to work together to prepare. The Bush administration proposed a plan that would have gotten the ball rolling. It could have had advanced enough to prevent COVID-19 from having such a major impact on our individual lives and the precious economy. The Obama administration created a playbook that spelled out word for word how to respond to any biological threat. Regrettably, the Trump administration wanted to make its own decisions apart from these. This led to a massive shortage in PPE, a lack of valid information, and a major recovery period to come for every citizen of the country. The Congressional Budget Office has projected just last week that the unemployment rate could stay at its current level for the next 10 years. We could have avoided that. Successful preparedness will require collaboration between government officials. It will also require adequate information sharing between professionals in public health, medical, law enforcement, and global communities. Most importantly, it will require proper funding from Congress for the resources needed not only to recover from COVID 19, but also to provide the resources to prepare for the possibility of another pandemic or biological attack. In addition, we need to learn from this administration. We as a country need to change how we fund agencies like the CDC, the National Health Service, and the National Security Council Pandemic Response Team. The aforementioned agencies should have permanent budgets that the president can only increase. Any alterations to the budgets should have to be signed off by the president, the vice president, the directors for each agency, 2/3 of Congress, and a comprehensive operational budget being presented to each one of them at every step on how the agencies will be able to maintain their full day-to-day duties without interruption before a single penny is taken from their operating budgets. By making the process that multifaceted, that difficult, you can almost ensure that these departments will remain permanently funded, and we will never again have to run into a situation where we're scrambling to try and get the information or the equipment that we need to mitigate a major crisis. If we make it functionally impossible to cut the budgets of those agencies, we will be able to preserve public health. Just to quickly summarize everything, the United States is not prepared to deal with any manner of major health crisis or biological attack because we have already shown through our COVID-19 response that we are greedy, we are selfish, we refuse to listen to scientific information, and we are so hyper-partisan that we can't even agree on how to resolve a major global health crisis to protect our own citizens. If you just take a look at the current rate of infections among the world, the entire planet has just surpassed 10 million cases, and the United States currently has 2.5 million coronavirus cases. We have known that this was a problem for months. And because of our hyperpartisan nature, because of our stubbornness, because of the lack of information, this has gone from one case just in January to not even a whole 7 months later, 2.5 million. And states all across the country are still trying to force themselves open to save the economy instead of their constituents. We don't have our priorities right. And if we continue down this path, we never will.